Let's move to health matters. Minister Joe Phaahla has today confirmed that one case of monkeypox has been detected in this country. Monkeypox is a virus that presents with a fever and a rash and is endemic to parts of West and Central Africa. However, in recent months, it has been picked up in quite a number of other countries as well. And now, our first case here. South Africa's monkeypox patient zero is a 30-year-old man from Johannesburg. Here's the minister.
Late yesterday, I received a report from the National Health Laboratory Service indicating that they have confirmed through a laboratory test the first case of monkeypox in South Africa. The patient is a 30-year-old male from Johannesburg who has no travel history, meaning that it cannot be attributed to the disease having been acquired elsewhere. So it means that it is with us. So working with the relevant health authorities, a process of contact tracing started to trace the close contacts of this gentleman. Monkeypox is usually a very mild disease, manifesting as blisters on the skin. It is usually mild and self-limiting, with a very limited fatality rate of about 1%. The disease has previously been reported in African countries such as Nigeria, DRC, Central African Republic, and Ghana in the early 2000s. The current outbreak is dominated by high numbers in Europe. The UK is currently leading just over 700 cases, Spain just over 500, Germany, Portugal, and France. Cases have also been reported in both cases just below 200 in the US and also in Canada. So the NICD is conducting online in-service training for our health workers for them to be able to detect the disease so that necessary laboratory tests can be done. The disease only spread through close contacts and not through droplets. So very dissimilar, very much unlike COVID and respiratory. It's not a respiratory disease, and it spreads through contact with an infected person. That's far in terms of the history from where it has emerged. It has shown to be more dominant amongst men who have sex with men, but it just emphasizing the fact that it is mainly through very close contact. That's how it is transmitted.
Yeah, some important points there from the health minister when he says that it is very much from close contact, and there's a lot of discussion about the outbreak in the UK amongst gay men is not because of their sexuality, but it is in fact very likely because of close contact within that particular community. And the other important points to remember is monkeypox has been around for decades. They've got the measure of it. And of course, the smallpox vaccine also protects against monkeypox. So we're in very different territory to COVID-19 of 2 years ago. Well, COVID infections and hospitalizations, of course, are very low in South Africa. Our immunity in the country is high, and that's probably why our mask mandate has been lifted. However, virologist Professor Barry Shube says the pandemic is most certainly not over quite yet.
Certain sectors of the economy, the tourist industry, the catering industry, the entertainment industry, they are certainly it's good news because they've really kind of taken quite a whack with COVID-19. So for them it is. But I think I listened to the last part of the minister's interview, the Honourable Minister, and I think he did make a very good point, and that is that the fact that you can legislate that these regulations go away doesn't mean that the epidemic is going away or the pandemic is going away. The virus is still with us. And I think we've got to think smartly. I think we've got to behave smartly and intelligently. And if there are high-risk situations, like, for example, in a closed environment with poor ventilation, then we do need to kind of take the precautions of wearing a mask in particular. And particularly if there are vulnerable people, elderly people who are around. So yes, basically, I think for the economy, it certainly is good news. I think that we are following many countries overseas, European countries and North American, so on, which have also similarly lifted all the restrictions. But I think we still need to be wary that the virus is circulating. It is still present at the moment.
Professor Barry Shube there. Let's move